Hey there, mamas. I want to talk about a common ailment that we unfortunately experience during pregnancy, and it is called round ligament pain. So currently, I am about 6 months pregnant, and I'm going to give a little anatomy lesson on the ligaments. So we, of course, have supporting structures in our body with muscle, fascia, ligament, tissue, right? And as our belly expands, this supporting structure gets stretched out. So we have ligaments in the front and even in the back. Now, if you're experiencing some pain, right, sometimes you can feel it where that ligament attaches, or it's even called fire crotch, but we have the ligaments on the sides and then they go down into the pubic bone. So you can feel the pain down low and you can feel the pain up on the sides or even underneath your belly. And sometimes it wraps around the back. Now, unfortunately, as our belly grows and expands, this bottom area gets really stretched out, and honestly, it actually gets a little bit weak, especially if we're not doing pelvic floor and core supporting practices. So what I'm going to show you today is a practice and a movement routine that helps support this structure of the round ligaments, where we build intra-abdominal pressure, and we'll be doing some things like squatting, inversions, lots of mobility and strength work. And this is safe for all stages of pregnancy. Now, you may start to experience this more in the middle and towards the end, but it is very uncomfortable. And some of the things that can spark that sharp shooting pain is getting up really quickly, moving too fast, too much time on your feet, sneezing, orgasm, any of those fast movements that contract the uterus and pull on those tissues. So I'm going to show you some things today that really will help to alleviate some of this pain and hopefully help you feel really good, and it won't take too much time. I have designed about a 20-minute practice for you. So let's go ahead and get started. You will need 2 blocks for today's practice and a yoga mat, and that's about it. Come down to all fours, hands and knees. So let's squat to get down. And bring your blocks here on the medium setting. So we'll move through some cat-cow with some little extra height. Now, begin by going slow. So let's start with extension. So take your low belly down, your chest through your arms, and without overstretching your neck, pull your collarbones forward. Now come back to neutral and just collapse, like relax down. Notice the difference. So we're not going to just collapse. We're not going to buckle or brace our way through. We want to use strength to go through some of these movements. So let's try that again from neutral. Move section by section. So low belly, low back, mid belly, mid back. Like you're doing a cobra pose, pull without moving your blocks, your chest through. Take a deep breath in. And start from the lower part again. Take your sacrum under, your tailbone down, push into your blocks, push into your knees, round your spine and drop your head. Lean back a little bit so that you can round your lower back, the part of your back that just tends to be an extension too much. Because our belly is getting heavy and it's pulling us forward. Let's go again slow, section by section. So by elevating our hands on the blocks, we're able, keep going, to stretch more at the top of our belly, under our breast and chest, where this gets really short and everything else gets overly stretched down below. So the more that you strengthen the stretch, the more benefit you're going to get. Go the opposite way, section by section. Lean back a little bit. Imagine you could pull your knees up off the ground. Now hug around your belly, around your baby, that nice loving embrace. Let's go one more time, section by section. Low back, mid back, upper back. Super strong, not collapsing. Inhale. And exhale. Round your spine. Lean back just a little bit. Drop your head. Come to neutral and sit back onto your heels. Shake out your arms a little bit here. Shoulders, ribs. So we want to build that intra-abdominal pressure. The more we let our bellies tip forward and just hang into hyperextension, the more pain we're gonna get. So we're building the pelvic floor core, wrapping from front to back, building from top to bottom, so that entire structure that is overly stretched has an ability to pull back in and tone and strengthen. Then we'll be doing some squats and things like that to open the pelvic floor and shorten the ligament, some mild inversions, and on and on. So this practice will feel really nice. Grip the sides of your blocks nice and strong, tuck your toes, push back into our first mild inversion, downward dog. Take your feet wide. You can come off your blocks if you'd like, and let's just shift side to side. So we get a little bit of that squat compression here and a mild inversion. And that will alleviate some of the pain, because when we go inverted, we take that pull and pressure off the downward or bottom part of those ligaments. Side to side. Forward and back a little bit. Stretching out through your hamstrings, the back of your legs. Shake your head yes and no. And then soften your heart down. Take a few breaths, letting your belly fully relax. And this compression here of your belly towards your hips will take some pressure off those ligaments. Very different than just sitting in a chair. Bring your knees down back to the floor slowly. And sit back onto your heels. So we're going to do some movement called kneel to heel, which helps us hug in and around the center. So take your blocks up to the higher setting and come to kneeling. Now from here, walk yourself up. Now at any point you need a break, you can just take your hands down on your block. So that's what this is here for. And also if you need a block underneath your seat because compression at your knees is challenging, you can slide one block behind you. Now slide up onto your knees and slide back down to your heels. So we're going to get controlled ascent, moving upward, and controlled descent, moving downward into that squat position. Now we'll add some breathing. Relax your belly. Breathe into your hands and around your belly. Inhale, neutral spine. Before you come up, hug and tone around your pelvic floor. Squeeze everything in and rise up to center. So you want to feel that pulling in. That pulling in around your abdomen. Come back slow, just 2 more times. Inhale, relax your belly, relax your ribs, breathe wide. Exhale, hug around, tone your legs, tone your core, hug everything in using the strength of your lower legs around that lower part of the ligaments. Hug and squeeze like you could squeeze a block. Good job. And kneel back down. Relax your belly, ribs wide, breath full. Inhale, so make sure you're not arching forward. And last time, hug. Like you could draw your pants in or zip up your zipper, tightening a drawstring, embrace around your belly, around your baby. Hug, squeeze, tone, everything strong. And come on back. So you can do as many of those as you would like. Squat down, push yourself back. Hands can come to your thighs and then stand on up. Let's take a moment just to shake out. So you can hold on to something, swing your leg to the side and behind. So this half pendulum. And depending on where you are in your pregnancy, balance might even be challenging. So this is another one that I really, really love, swinging your leg. Think how often we just kind of, maybe we don't feel good, maybe we're tired, we kind of pull in and around, or we just arch and collapse, right? So we want to have a conscious structure. Open through the middle of your leg, behind to the sides, freeing up your leg. Also, we want that circulation. Maybe your legs have been feeling a bit swollen or heavy. And switch. Again, I just recommend holding on to something so that you don't fall over. If your balance is really stable, you can let go. Swing to the side and behind, out, behind, freeing up your leg, your pelvis. 3, 2, and 1. Let's add some squats here. So I'm gonna go from the side just to show you how I get into it. So bring your hands down onto your thighs, walk your hands forward and come down to the floor. Now bring your left leg forward as you sit back. Half primal squat. Okay, now if you need a block, you can slide that underneath your seat, so you have a little bit more support. Now what that looks like from the front is this half primal squat, kneeling and squatting. Now shift your weight forward and shift back. Shift to the side, you can come out of the compression and back down. Again to the side, kick your leg out and back down, lean back and forth. Breathe in and out through your nose. Now again, if this is too much for your knees or anything, you can stay upright, kneeling, so you're in that short lunge position. Rock and sway. Otherwise, just continue to explore your movements all around. So the squatting is essential because it takes, again, that pressure off the ligaments. Also, we need to practice squatting in preparation for bringing our beautiful babies into our arms. Switch sides, kneel and squat. Half primal squat. So this is one that I take a lot. So if I'm down on the ground folding laundry, playing with my dogs, even on a client call, I'll move my computer in front of the fire. As much time as you can get in the squatting position and down on the ground will be really ideal. Super, super helpful. We don't realize that we just kind of flop into the couch and into the chair. My first trimester, I was so sick that I could hardly move. But whenever I did move, I felt a lot better. I felt way less sick. Keep going. And now we'll take a double squat. So lift your blocks up, shift forward, and come into your double squat. I like to do this on my tiptoes, so just shift side to side, rocking back and forth. If that's too much for your knees, come upright and work on squatting side to side. But over time, you are gonna wanna build your mobility to squat low. Again, in preparation for your birth and to take some of that pressure off your belly and your hips. Squatting is one of the most important things you can do in pregnancy. Just remember, it doesn't have to be all at once. You can do it throughout the day many times. Push back, hands to your thighs, big breath in, stand all the way up. All right, take a moment just to feel, shift side to side, take some big hip circles, some arm sweeps. And again, this is a sequence I like to do before we're walking. Now let's just practice that we were walking. So one of the things that happens, so just go ahead and take a walk. Imagine that you were walking. They say to walk in pregnancy. One of the things that happens, so look up here on the screen, is as we get bigger, we do this kind of a walk. It's more of a waddle, isn't it? We don't realize we don't swing our arms. We're just kind of like waddling forward. One of the things that's going to be so important to alleviate this pain is as we walk, is to imagine that you had hands under your belly lifting up. A lot of times people say to use a wrap or a belt, but you want to actually build this from your own intra-abdominal pressure. Then as you walk, swing your arms, opposite arm to opposite leg, and then make sure that you're not waddling side to side. That's honestly a big issue with these ligaments is we don't realize we just kind of start to do this. So you want to keep yourself upright, light on your feet, keep that walking really intentional, and imagine that you are lifting up around your core when you're walking. So you want to have some of that tone so that when you walk, you don't just let everything spill forward and kind of slog your way through your walk. Okay, intentional walking. Now let's take that intentional walking again into that swing. So instead of falling down and forward, doing this, find that intentional swing. Imagine you are walking, that you're upright, you're connected to your body, and we are not waddling or slogging our way through. This is really important in your third trimester, you guys. That's one of the biggest things I tell my clients is be very conscious that you don't start walking side to side. It's very bad for your low back and for your ligaments and creates a lot of weakness. Switch sides. So we want that pelvic floor tone. One of the things I do is I wear a weighted bag on my head so I can get, really solid walking. Imagine that you were rising up, not being pushed down. 3, 2, and 1. We have one more drill here, which is functional flexors, so some really great lunges. Squat down, move your blocks over to the left side, take your right leg forward and your left leg back. So you can have your blocks on the high setting or the medium setting. I'm gonna go high. And then lower your pelvis without collapsing it. So a neutral position. Relax your belly, breathe in. And as you exhale, lift your back leg without lifting your pelvis. And you can find the difference here. So back leg lifts versus pelvis lifts. When your back leg lifts, you can tone and strengthen through the ligaments, your psoas, your whole hip flexors and company. Lower your back knee down. Inhale. Exhale, lift, squeeze, and tone. Lower back down. Inhale. Exhale, lift, squeeze, and tone. Stay here and pulse just a little bit. 5, 4, very small. 3, 2, 1. Squeeze, stretch your two legs apart, and release. Switch sides, walk your blocks over to the right, and left leg forward. Tuck your back toes. Again, find your neutral stance without lifting your pelvis. Lift your back leg. Squeeze and tone, arms strong. So even here, you're building strength in your arms. Lower your back knee. Inhale, relax your belly. Exhale, lift and squeeze your leg. Lift and squeeze your belly. Hug everything around the midline, front to back, inter-abdominal pressure. Lower your knee. Relax your belly. Relax your neck. Inhale. Exhale, lift, squeeze, and tone. Squeeze and hug around everything. Drop your back knee. Deep breath in. Exhale, lift and squeeze, hold without lifting your pelvis. Just very small pulses of everything. 5, 4, 3, 2, 1. Stay here. Stretch your two legs apart. Fire, squeeze, and release. Bring your back knee and foot forward. Sit back onto your heels. Shake out your arms. Good. Now we're going to finish with one more inversion. So I'm going to give you 2 options. You can take your puppy pose, stretch your arms forward onto your blocks this way, where your head comes down. You can do this without blocks. And if you want a deeper inversion, you can take a wide leg forward bend. I like to take my blocks very forward and drop down. So we did this similar with the downward dog, but you're getting a full inversion here, which is so helpful. And you don't have to do much here. Just let your belly relax. And you can alternate between both if that's a lot for your legs. Breathe and stretch. Sometimes I like to bend my elbows too and take this position with my arms behind my back. So you've got a few choices here for your inversion. You don't have to be here very long. One more inhale. One more exhale. Whatever position you're in, come up. Come to kneel. Place one hand on your belly, one hand on your heart. Close your eyes and just remember here that so much of what we experience in pregnancy can catapult us into a place of fear or distrust in our bodies. But when we begin to move and we breathe and we slow things down, we can actually trust our body again and discover that there's a medicine within. Movement is one of the best medicines for pregnancy. So with your hand on your belly, connect with your baby, connect with your heart. And remember the beautiful, magnificent thing that you are doing right now, building this life within. Connect to this life, connect to your breath. And may our structures of our body be stable, connected, fluid. May this be a very sacred and heartfelt, connected time. Thank you, everybody. Many blessings on your beautiful pregnancy journey and your birth.